Hello everyone. This video is a very quick walkthrough of the HCPCS Level 2 manual. This manual is the third in our series of manuals that we'll be using on the national exam. The ICD-10 is for diagnoses, CPT is for the procedures, and HCPCS is kind of a catch-all of services, supplies, medications, and just a variety of other little things that we don't have in our CPT. So you might notice that this one says level 2. Don't worry if you do not have a level 1, there is not a manual that says level 1. This is our level 1 codes right here. And then the HCPCS is the level 2. I will be using the Bucks, but if you have another publisher, AMA, or a different publisher, that's totally fine. The information is exactly the same. The only difference will be in some of the supplemental layouts of the material, such as like the illustrations and things like that. And I will be using the 2022. I would recommend you use the 2022, the current year's edition. For the national exam, you can use the current year's or the previous years. Always double check with the AAPC before, but historically they've allowed the previous year's or the current year's manual. Let's get started with it. And it's going to be a very, very quick overview, and I'll explain why here in a moment. So this manual does have this very annoying little flap that you can use as a bookmark if you would like. There's a lot of blank space, so feel free to fill these up with notes. It does not have to be specific to HCPCS. If you have notes that you don't have room for in your ICD-10 or your CPT, come and use these blank pages or empty spaces. Just make sure that you reference that in your table of contents in your other manuals, okay? There is a table of contents here. It is not extensive, so we would not code from this the way we would in the CPT, but it is helpful in getting us to exactly where we want to go fairly quickly. There's an introduction here. This is where we have our symbols and conventions. I'm not going to spend a lot of time on it. You will notice that they are very, very similar to your CPT manual, but you can reference this quickly if you run into something that is unfamiliar to you. The status indicators are listed here. We're not going to get into these either, but know that the tables are here and you can look them up very, very quickly if you need to. And these are very self-explanatory, so it's not terribly difficult to use. These are the HCPCS updates. These are not going to be helpful to you if you are just learning HCPCS starting today, because all the information is new to you. So why would you care what is different from last year? But moving forward, if you do become a coder, this might be helpful for you. This might be a good thing for you to be able to reference. If you have the Bucks, you will notice that we have some excellent illustrations in this manual as well. I would recommend knowing what is in these illustrations and keeping a running list somewhere, because these can be very, very helpful on those anatomy questions. Lots of blank space as well for other notes. When you get up to page 1, you'll notice that we have an index very similar to the alpha in the ICD-10. It's at the very, very front. It's arranged alphabetically, and it works very, very similarly. So there will be a term, and it will send you to a code. In this version, the code is in blue, and or there might be a range of codes, and then you will double check them in the essentially the tabular. Okay, it's not a huge index, but that's just because there's not that many codes in this manual. I mean, comparatively, compared to what we have in our other two manuals. But it does work exactly the same, and it's very easy to navigate. There's a table of drugs. So this works very intuitively. You look up the drug. It's not going to be name brand, it's just going to be the drug. And then it directs you to a code or a series of codes. You'll also notice that it includes the dosage. This is going to be the most common dosage. And it will also have a column for administration. So this is the method of administration. That could be oral, it could be subcutaneous. There's a little cheat sheet up here if you need it. And that's just because some medications have a variety of methods by which they are administered. So you will, most of the time, you will know the dosage and the method of administration, and you will find the appropriate drug name here, and then that will send you to a code or a range of codes. It's very, very easy to navigate. This might seem overwhelming or tricky, but I promise you, once you do a couple, it's going to make perfect sense to you. Okay. Let's see here. Most of the codes for drugs are going to be a J code. So if you see a series of J codes on a question, you will know that's likely about drugs. There are a few P and Q codes, maybe even a couple A codes in here, since that has some of the kind of catch-all codes is in the A section. But most of the time it's going to be a J code. All right. And after this table, we get into the actual codes themselves. We start with the modifiers. There are a lot of modifiers in here. The HCPCS specific modifiers are going to be 2 letters. And then there are also some that are, you might remember in your CPT that we have modifiers that are 2 numbers. And so those are not listed directly here. These are all going to be our 2-letter modifiers. They can be used on CPT codes, but we'll get into more of how to correctly apply these in a different video. But I did want to bring your attention to, this is where these are. I think when I took my national exam, I had no idea where these were, and I was very confused, but here's where they are. So you will not have that problem. But the important thing to know is that, yes, they can be used with CPT codes, especially things like RT is right side. We do use that quite a bit, right or left, in CPT, but it's just important to understand that some of them might not be appropriate for use for all codes in the CPT or even any codes. It's just important to understand which ones apply in each circumstance, okay? But a lot of them, yes, can be used in CPT. Then starting on page 113, we start with our A codes. All of the codes in this manual start with a letter, and there is not a decimal point, unlike what you've seen in the ICD-10. So alphanumeric, yes, but no decimal point. And you'll notice they're not, these are not main categories with sub codes. Okay, there's just one code listed. It's very, very easy to find the code that you're talking about and to verify what it's about. It's listed here explicitly. It's very simple to follow. Like the ICD-10 in this version anyway, in the Bucks, each chapter is color coded and relates to a specific group of types of codes. Like I said, we had drug codes, we have transport services or A codes, prosthetics are L codes. I believe on my national exam, there was a question about a prosthetic. So just be aware of what is in here and that it goes from A to V. And that is pretty much it for this manual. And I know you're probably thinking, wait, you didn't do anything yet. You haven't shown me anything yet. That was not enough, but I promise you, this is not going to play a huge role in your national exam. They've recently changed the structure of the national exam to 100 questions. And of those 100 questions, you need to get 70 correct in order to pass. And only 3 of the questions total of those 100 are specifically about HCPCS. So it's a very, very small percentage. So I really rather we focus our attention on preparing with the CPT, the guidelines, understanding how to deal with the ICD-10, and focusing on case studies, of which there's 10. HCPCS, yes, they're important. Yes, you will use them in the real world, but they don't play a huge role in that national exam. So I don't want to over prepare or get bogged down in learning all the details of the HCPCS manual. So when you find one of those 3 questions that's specific to HCPCS, I would recommend you just look up each of the options. And I know that's cheating, I guess. I mean, that's not the proper textbook way to look up HCPCS codes. But I think for the national exam, that's your best bet. And so that's what I recommend you do. So there will be 3 questions on the national exam that are specific to HCPCS. And then you might see a few more HCPCS codes in like the case studies. But that's not going to be the focus of that case study, is not a HCPCS question. So I would still, if you see it in another question, still just very quickly look it up. It's a short manual. It's very easy to find. And the codes make a lot of sense. They're not tricky or super overly complex or anything like that. Like it'll be a glucose monitor with integrated Lansing or blood sample. Like this is a very, very straightforward thing. So there's not a lot of tricky HCPCS codes in there. All right. So I would like you to, yes, of course, do your homework, read through the chapter, practice a few questions. But also keep in mind that this plays a very, very small role in your national exam and is not going to heavily play into you getting your CPC. If you do have questions about it, concerns, please post them in the discussion and we will work through them together. Thank you all. Bye-bye.